Hi, and welcome to the CAFMA Connect. I'm your host, Fire Chief Scott Freitag, and with me, my special guest once again, EMS Chief Extraordinaire, Doug Niemynski.
Happy to be here.
Doug, how you doing in 2022?
So far, so good.
We're 2 weeks in. COVID's still here. It's not going away.
No, I've been testing a lot of people.
You know, it's interesting, and we're gonna talk EMS stuff today as well, just kind of where we're at, what we're doing. But I read a story last night, and surprisingly, this goes to just my personal opinion related to CNN. One of their anchors or reporters, whatever, was talking to their lead doc for CNN, and he's like, why is it that the hospitals can't tell us and the CDC can't tell us data-wise who's in the hospital for COVID and who's in the hospital with COVID? Because for and with are two different things. You break your leg, you're in the hospital, and they test you, and they're like, oh, you have COVID. Mm-hmm. And you're like, I don't know, I had COVID. I feel fine. I have sniffles. And they're starting to put pressure on the CDC because the CDC's never separated the data between who died as a result of COVID and who just had COVID when they died.
That'll be good info to see.
Right. It's interesting to see some of these networks starting to call out what we've been asking for since the beginning, which is factual information.
Mm-hmm. I thought it was kind of funny, too. In Chicago, did you see how the school system refused to come? The teachers didn't want to come back to work.
Right.
Because of the safety things, and now they've demanded N95 masks. And I'm like, well, at least they're doing it right, you know? So,
well, that's the thing. If you're going to wear a mask, wear an N95 mask and be properly fitted for it, because the other masks don't work.
Yep.
And they're not a fashion statement.
Nope.
So we are seeing, though, fortunately, the Omicron virus. Next one could be Megatron. We don't know.
I'm hoping.
But the Omicron, a lot of folks in the field are saying, hey, this is more like a cold or a mild flu. They didn't see any deaths or any major problems in Africa from Omicron. And it seems like we're seeing more mild cases. So hopefully we're on a path to get back to where we just tell people, hey, if you have a fever and you're sick, don't come into work.
I know we're doing the new CDC guidelines. So, at day 5, we retest and see if they're still positive.
Right.
And if they're negative, obviously in 2 days, and day 7, they're able to return to work. And that's been working out pretty good for us.
Right.
At least having that ability to test and then knowing that they can come back sooner than later. And we don't have a vast amount of people out at one time. So we've been fortunate to kind of stagger our cases throughout this whole thing. Yeah,
that's been good. I know there's a lot of strain on the healthcare system across the country, and that was one of the points that they were making. And don't get me wrong, I don't watch CNN. Honestly, I don't watch the news. I just pick it up here and there. Mm-hmm. But they were talking about the strain on the hospitals, and the point they were trying to make is, you're trying to put the strain on the hospital solely on COVID, and the fact of the matter is that's not it. COVID plays a part. There's a lot of sick people out there. Now, they didn't say this because, of course, they wouldn't. But when you start firing people because they refuse to get the shot that isn't working, well, you're going to be short-staffed. Mm-hmm. So now they're saying, hey, if you have COVID, just go ahead and come into work and wear a mask in the healthcare industry. So you're vaccinated, you have COVID. I thought, never mind.
We're not there. We're not telling guys to come to work with COVID,
no.
So I'm glad we're able to have people stay home and be safe.
Well, and that's what we're trying to do. We don't want, like you said, we're getting it in small waves that's not impacting our operations. Yeah. And that's good. We don't like to see people sick, but it is the time of year where people get sick.
And they are. I mean, I'd say about half the people that I've tested have been negative.
Right.
Cold and flu-like symptoms. So it's...
What?
Yeah.
Is the cold and flu back now?
I think so.
Are we acknowledging that the cold and flu still exists?
I don't have an actual test to say that it is that, so who knows what it is. But
that's okay. We're not sure the PCR tests actually tell you whether it's COVID, the flu, or a cold.
Yeah.
You're not sure?
I don't have PCR tests. So.
Oh, okay. Well, that's good.
Yeah. Antigen only.
We have the other tests. So let's talk about EMS, Doug, as we move into 2022, obviously we're completing our assigned portion of the substantive review that was done at the state. And so you submitted your
responses to some clarification stuff. Yeah, it's all submitted, and now we wait.
So it's back to the consultant. All the ARCR stuff has been resubmitted, so that's good. We're in a good position there. And now our consultant and other attorney are working on some finalizing some responses, and then we'll all get together and we'll get it resubmitted. Deadline's February 14th, but we want it in. Like to see it in before the end of January.
Yeah, me too. Because then, if there's any additional questions, we could take care of that.
Right. So the next step after that is they'll review the fee for service that we've proposed, which is about $75 less. Is that right? 75 less or 25 less?
It's 75 less than they had got an upgrade.
A rate
in their
adjustment.
Rate. Yeah. I think that was last year's adjustment, not the one that was scheduled for this year.
Right.
I don't really keep track of what their rates are, honestly, but I know it's going to be higher than what we're charging.
Right. Well, and part of that is, and that was one of the questions from the substantive review is, why are you charging less? You said you were going to charge the same. Well, because when we wrote the document,
we wrote it a year ago.
We were charging the same.
Or a little more than a year ago now.
Right.
So
we've got that clarified. And then on the supply side, where it appears AMR charges about a 230% above market cost for goods, we're just going to charge the consumer what it cost us. So if a Band-Aid's 5 cents, we're going to charge them 5 cents. So I think that's pretty good. We'll get through that. And then once that's done, then the dreaded interveners and being drugged through hearing by AMR, which we're pretty sure is coming, but we'll see. And that's what will drag it out, because if it wasn't for that, if the director could just make a decision, we could be up and running with our CON in pretty short order. But the way the process is in the state of Arizona, the CON process, one of only 2 states that still uses this antiquated draconian system, we have to go through a hearing process, which can be timely or time-consuming, costly, not pleasant.
And it's designed to be that way. Those CON laws were written way back when Arizona was like a rural state for the most part. And I believe I've heard that they were designed and written by, the private ambulance sector.
Right.
So they wrote them in a way to protect their interests, and it absolutely does that.
They did. And what's interesting is the people who wrote that are still around in the state, but now they're consultants working for the highest bidder. So sometimes they may work for a fire department fighting against the very statutes that they wrote. In other cases, they may be hired by a private company who is fighting against the fire department, and they're arguing for the statutes they wrote. It's just an interesting dynamic with that. But we do have, so along with our CON, once we get through that, we'll get our CON. But we're also running some CON reform, some legislation. And when I say we, I mean the fire service in the state of Arizona. So we've submitted a bill that was put together with input from across the state, really to update the process. There's been no reform to that CON statute since it was written that we're aware of. And so it still remains a roadblock to the free market. It creates a lot of unnecessary red tape, and it provides absolutely zero oversight.
It's basically a sanctioned monopoly, the way it's written.
Right.
So I'm hopeful that CON legislation will gain traction and go somewhere, because we need other avenues for people to put in for CONs in the state and provide service.
Right.
So.
Well, and part of this, when we look at it, and you and I were talking about it, because obviously we've talked a lot about on the podcast about the challenges we face with transport units. And as a matter of fact, I was talking to Captain Postula before we came in here to record today, and he said at 6 o'clock this morning, the day we're recording, 6 o'clock in the morning, they had a call out of Station 58 in PV, and the closest ambulance was at Heather Heights in the city of Prescott. So 6 a.m., no calls on the docket. 1 unit available. It's in Prescott, 0 units in the town of Prescott Valley. Just for you elected officials in Prescott Valley to understand, you're getting the short end of the stick here, and your people are not being taken care of. So those things are a challenge, but I found this interesting because you reached out to the state, and the question we had was, if AMR can't get to the call, and there's no backup agreement with us because we're not a CON holder, and they're the only provider up here. Now, they do have a backup agreement with Mayor, but we know that they're a long way off. But if we end up transporting the patient, or Prescott ends up transporting a patient in a private vehicle, in an engine, in a BC rig, or in one of the rescues, does that count against AMR's performance within their CON? And the answer from the state was?
They were like, well, that's a good question. You should bring that up at the Rules Committee meeting, which we're involved with, the Article 9 Rules Committee on response times.
Right.
It's a great committee comprised of all the different stakeholders. And yeah, I would like to know how to handle those specific situations, because in my opinion, a 911 call was made. They're the CON holder. They couldn't respond. We did. Helped out the patient, transported the patient.
Right.
But since they didn't transport, it's not counted against them as a response time, because in order for that to work, you have to respond and get on scene.
Right.
And so how can we change that in the future to reflect it as a performance measure, that you can't meet those calls for service?
Yeah, because that definitely goes directly to, hey, your CON says that you have to respond here. And let's be clear, the CON response times in the state of Arizona do not follow any type of nationally recognized response time for EMS. It's woefully off base. And then you get to average them over average your response times over the entirety of your CON, which is crazy. And then it's self-reporting, and you don't have to really provide any data, and there's no checks and balances, audits, anything. So even though the state knows about all our transports, are they looking at that with the data that AMR is presenting them, saying, because when AMR presents, they're like, hey, give us a gold star. We're meeting this 98, 99.9% of the time. We know that's not true.
Well, we've known it forever.
Right.
It's just the way that the CON's written, and it's written in their particular CON. It's huge, and being that they average it out, it's hard not to meet those minimum response goals for them, because it was written that way. If we had our way about it, you would have specific response times in areas, and the way that the state law reads is urban, suburban, rural, and wilderness. Right. It should reflect those kinds of response times. So in PV, it's a suburban area, you would have a better response time.
Right.
Versus, we get a call on top of Mingus or something like that. You're not going to make it there in 10 minutes, and everybody knows it. So, make it reflective of what you should or can do, not an average of everything that hides your flaws, And
it should be based on a geographic area, specific geographic area, not 9,000 square miles, but here's the town of Prescott Valley or the town of Chino Valley. What are the response times required and expected in those areas? And it's certainly not what's in their CON at this point. But then if you're not having to report when you're failing to perform, when you're not even getting to the call because you don't have an ambulance available, or you're an hour away, or we have a critical patient and you're over 30 minutes away in a densely populated area, that's problematic. So we want to see more oversight with that. We're not creating new regulation. We're just saying within the statute, there should be a level of oversight. And I think that also goes with CON 62. Do you remember when that one was originally issued?
Before the update, it was probably, in the 60s or something like that.
I thought that was issued in like 1980 something.
Was it?
Yeah.
It's been a while. I don't know the original date on it. What I do know is they updated it recently to improve their response times, I think it's due to some of the pressure that has been placed on them.
Oh yeah.
From you and I.
Well, think about it. One, so 40 plus years.
Mm-hmm.
Every 3 years, the CON is quote unquote reviewed, except that it's not actually reviewed. It's just rubber stamped. And it's never actually looked at between the Bureau of EMS and the ambulance transport provider to say, hey, has this region changed? Has the geographic boundaries, have they expanded? What's the new population? Is it more densely populated, less populated? At one point, Prescott Valley was known as Jackass Flats.
Mm-hmm.
And today, look at the bustling community that Prescott Valley is, and yet no changes in the CON until 2020 or 21. Even then, they weren't meeting the standards in the old one. They're not meeting the standards in the new one. And the standards that are in the new one don't reflect any type of real recognized response standard.
So, yeah, they did improve them compared to the original times.
Well, in writing on paper, but not actually.
Yeah, the difference is, what we would like to see for a suburban community would be like 10 minutes or less.
Right.
They're not there. They're like 80% of the time.
It's in the 90th percentile.
We like 90th percentile in this industry. And so, and part of the Article 9 Rules Committee with all the folks from the state getting together, trying to define how should the state make response times more applicable, like what we've been discussing. Right. So I'm hoping that we can all come to that agreement and say these are acceptable. And we're still working on that, and we got a meeting, I think, tomorrow about it.
Yeah, tomorrow afternoon we have a meeting.
Yeah.
And we'll see where that goes. But this requires some reform, some legislative reform, mm-hmm. as well as updated rules. And so it's going to be a hard-fought battle, mm-hmm. a big lift down at the state level to move this. So we're going to be sending out a social media post here in the next several days asking the public to let us know if they've been impacted by the lack of ambulance transport resources. And if so, if they're willing, email us that information. We've got a new email address that Jonah was kind enough to put together for us, ambulance@cazfire.org. And we'd like to know what the situation was, how you were impacted, and are you willing to testify at the state and committee? Because we need the legislators, the elected officials need to hear from their constituents in the community, not just from us mm-hmm. or other fire service leaders around the state. They need to hear from the public. Hey, here's the issue. Now, I want to make clear, our CON and CON reform at the state level are mutually exclusive. So our CON is completely separate from that. So CAFMA is working on our CON. Mm-hmm. The CON reform is a Arizona Fire Service issue that we're working on, and we've hired a lobbyist on that side to work with us to push that reform. Where the two intersect from time to time is this reform is needed because of these types of examples.
Yeah, it's written, like we said, to protect the private providers and their monopoly. And so I think the language that you guys have crafted as the Arizona Fire Chiefs and the AFTA and all the research you guys have put into that, it looks good on paper, and we'll see if we can get some traction on that. I'm hoping.
Well, and it's helpful that the news stations are picking this up. We did Channel 12 this week. I'm on Yavapai Broadcasting next week on Wednesday morning, recording a radio program. The Republican Women of Prescott, the largest Republican women group in the country, shout out to them. They're awesome people, have invited me to speak in March at their luncheon. So I'll have the opportunity to go before them. I'm hoping by then we have some idea where the legislation is going and what we need, so that I can present to them, here's the problem, here's how you can help.
Great.
And they're a pretty powerful group of folks. I spoke to the County Board of Supervisors recently, and one of the things that people often bring up is, hey, every time there's a problem, we shouldn't expand government to deal with it. Because there's this dialogue from time to time, or the disagreement about whether government should be providing 911 ambulance transport. Is that an expansion of authority? And my position is this, and I don't know what you think, but I think the government has three primary jobs. And anything beyond that is debatable, but three primary jobs. The first one is infrastructure. The second one is education. And the third is public safety. And public safety, to me, encompasses our military, law enforcement, fire, and emergency EMS transport.
Mm-hmm. I agree with you. I think that, fire-based EMS, to me, is the way to provide a better service. You just... With the private industry here, and we've seen it here, I used to work at Lifeline back in 1997, 98. It was different back then. There was, more pride in it. Like, I enjoyed going to work back then. It was great. I'm not hearing that right now from their employees. They're tired. They're feeling like beat up.
Right.
They never get a break. And so, for whatever reasons that they have going on in private, they just can't keep enough units staffed or hire enough people to meet the needs that we have here.
Right.
So what are we supposed to do? We're trying to help supplement the system with 2 ambulances is what we're asking for from the state for a CON initially. And if we needed more, we would ask, at that time. But 2 ambulances is not going to put a private provider out of business. It's merely going to supplement what's going on up here and allowing those private folks to take interfacility transports down to Phoenix where they need to be for care. And we're going to run 911 traffic.
Right.
That's our goal. We're trying to help here. So we're not trying to put anybody out of business.
Well, we're not trying to expand government. We're trying to stay within what we believe are the government bounds. And
Sure.
part of that is 911 transport. No, we're not increasing taxes if we get our CON. The ambulance transport revenue is supposed to support that, and our ARCR, our financial analysis that we had done by an outside third-party expert shows that we can support and sustain that. I think we're going to have more calls. What we put in our CON is very conservative.
Very conservative.
So it's not a massive expansion of government. It's not an overreach of government. It's within our purview, in my opinion. It doesn't increase taxes. And we're not trying to put a private company out of business. As a matter of fact, the interfacility is where they make most of their money because that's a dollar for dollar transport, where on the 911 side, it's about a 49-cent, 50-cent return for every dollar you spend. Now, how does that break even over time with the call volume that we have? We will see those numbers not only break even, but put us in a position to put more units up and cover those as needed. It's not going to be just randomly putting them up.
I think that's something, too, that I've been thinking about is we wouldn't even be putting in for a CON if Lifeline was meeting our needs.
Right.
They clearly cannot, and they've demonstrated that over the last several years. It started out with increasing response times, and it just got worse and worse.
Yep.
Now they cannot, respond in a timely fashion or with a medic on board. It's a BLS rig most of the time here, at least in PV. I know, that might be different in the city where they had signed that agreement for 2 units, but I'm pretty sure that they're lacking the same services there as well.
They are.
Yeah.
I've heard it from the city. They can't speak about it because they signed the agreement, but we're not going to sign an agreement like that. We're not interested in an agreement with AMR Lifeline at this time. My feeling is, hey, look, we've talked to you for 6 years. We've offered opportunity to sit at the table and come up with a working partnership. They didn't do it. Not until Priority Ambulance, the other private company that's submitted a CON for up here, till they submitted a CON. So signing an agreement with them would completely undermine that second private company coming up here, which is what the taxpayers have requested, as well as us having a couple of units in the system. So we don't want to undermine that as part of the process either. But what my response is back to AMR is, look, when we get our CON, we're going to sit down with you and we're going to develop backup agreements and work on response plans and things like that, how this is going to work with, and not just AMR, but with whatever private company is up here. Right now, it's the system is not working. And it's interesting, Doug, because Yavapai County, not all things are equal. If you look at the Verde Valley side, they have a very good system, and that is a private company, and then fire-based ambulances, transport, who run seamlessly together. They have more resources and less people than we do.
Yeah. The other thing, too, with us just applying for the 911 side of the house, so whatever we do bring to the table, if it's the 2 ambulances, it's not going to help the situation with the hospital trying to transfer people to Phoenix. They're having their own struggles, and they need additional resources for that. So, and that's not something we're going to provide.
No, and that's where Priority Ambulance can come up here, provide that free market competition. The current CON statute's a roadblock to free market competition, and they can work with the hospital to provide more interfacility transport services while we're working with them on 911. And we'll see if Priority is successful in getting their CON, then our intention is to put out a request for proposal, and AMR and Priority can both submit, and then we will sign a contract with whoever the best bidder is for that. That's if Priority gets their CON.
Sure.
But both companies have asked us to run a couple of ambulances. It's just a matter of getting that CON. Right now, AMR is saying either sign this or we're going to fight you in court. Well, we're not going to be coerced into signing a bad agreement with a company that, well, quite honestly, our interactions have not been such that it builds trust. Unfortunately, their ethical standards and our ethical standards really don't match.
I haven't gotten into the weeds on a lot of that
At the corporate level.
Yeah. What I can say is dealing with the local folks, I got an open relationship with those folks and call them up and discuss whatever it is. The major thing that we can't agree on is because in that contract that they would like us to sign, it says we're not supposed to talk publicly about issues, that we're supposed to do that in-house. Well, we tried that. It didn't get us anywhere. And it basically is going to limit the growth of the system. At the end of the day, what we need up here is more ambulances.
Yes. And
like everybody said, a lot of people don't care who shows up at their house as long as it's an ambulance.
Yep.
Well, guess what? Right now, there's only one, designated provider for that. So you're only going to get that if they can bring it. If we get more people in the system, including us, including Priority, if they're successful, now we have options, and that grows the system.
And that's no different than the Valley.
Yeah.
The Valley, the Phoenix Valley, the Tucson area, all have options. But some of the communities like ours, and not just ours, but other communities in the state, like Mojave County, Kingman, Lake Havasu, down in Pinal County with Casa Grande, there's only one provider. It's a monopoly, and that provider does everything they can, AMR, to prevent any other competition while at the same time failing to provide services. And so that becomes a problem. But we're excited to say that we have been able to adjust some things in our capital budget. We just ordered 3 brand new rescues.
Yeah.
Because we can't call them ambulances.
They look a lot the same, but
yeah. And we have one that we're purchasing, hopefully, if it's approved by the other board of directors. Our board has approved the purchase. We'll be buying one from another agency, a used unit that we're already running, so that's good. But I don't know if you're aware of this, Doug, but when you borrow equipment from other people, eventually they want the equipment back. And we totally understand that. We have a proof of concept. We're transporting quite often. December 27th, we transported 11 people. This morning, 6 a.m., no units in Prescott Valley. We know we need to have these things to operate. And right now we're still waiting and trying to push the governor for temporary authority. But until then, we're going to have to run these as rescues. And they're needed equipment for our agency, needed equipment for the area. And so we're excited. First one's supposed to arrive tomorrow.
Yeah, and I think I'm going to be stuck in that Article 9 committee meeting when it arrives, so I won't be able to come see it. But excited to see these new rigs showing up. I know the crews in the field can't wait to have some stuff to use that's theirs, and we can return Mesa's stuff down to the valley where I guess they need to upstaff some units. So
Right.
just shout out to Mesa and Northwest that have loaned us those rescues. They've been lifesavers.
So the only question I have is because we ended up having to buy what was available, and
we did.
They're Ford and they have the blue oval.
Two of them.
Did we get the extended AAA for towing when they arrived? Do they come on a flatbed already?
No, we just issued tow straps to a bunch of the mechanics.
Okay,
We're
yeah.
good.
I know as Chief Carruthers said to me, he said it takes a village to own a Ford. So we have Chevrolet BC trucks. No, Chief Carruthers owns a Ram.
Oh, it's a Dodge.
But yeah, he's offered to
come
tow
tow us out.
the Fords back for us, so we appreciate that. That's for you, Chief Abel and Kyle Runo. We know quality, and we're removing the Ford emblems just to see if it helps.
At least we'll have firsthand knowledge after owning these, just how well they do for us. So,
well, Doug, thank you for coming on. We're going to close out this week. I think we've got some good information out there about what we're doing, why we're doing it, where we're headed. Jonah, thank you once again for being in here. And we're talking about maybe doing something on cybersecurity for your home and office, especially for people like me who have district or agency issued equipment. So I likely watch for Jonah on here soon. And Josh Redfern has volunteered. So looking to bring on one of our newer folks and have him talk to us about why he chose this profession and why he chose to work here.
Great.
So it's good stuff. Until next time, I hope you have a wonderful week, and we will see you next week.